Pleasant greetings, everyone. I am Dr. Nika Hull James.
Good morning. Good morning, all. All right, so good morning. We would like to call the meeting to order. Before we commence, I would like to invite the Hyatt team to deliver the safety brief. Ram, Minister of Agriculture and Fisheries of the Republic of Trinidad and Tobago. Dr. Lisa Musai, CARICOM Chief Veterinary Officer. Dr. Lisa Indar, Executive Director of CARFA. Dr. Horace Cox, Director of Surveillance, Disease Prevention and Control of CARFA. Mr. Ian Horseshoe, Senior Health Specialist, Inter-American Development Bank. Chief Veterinary Officers, National Epidemiologists and Food Safety Focal Points, Chief Environmental Health Officers, Laboratory Directors from our CARFA member states, Dr. Franca Devine, Advisor, Disease Surveillance and Epidemiology of the Pan American Health Organization, Ms. Nicole Darmani, Program and Portfolio Specialist of the Food and Agriculture Organization of the United Nations, Dr. Lisa Harinanan, Agricultural Health and Food Safety Specialist of the Inter-American Institute for Cooperation on Agriculture, Ms. Rachel Lunt, Principal Scientist of Epidemiology of the UK Health Security Agency, Dr. Eric Etter, Veterinary Epidemiologist with the French Agricultural Research Center for International Development and Secretary with the Caribbean Animal Health Network, Dr. Tiola Noel, Chair of the Veterinary Working Group of the Caribbean Animal Health Network, Dr. Patricia Johnson, Chairperson of the Caribbean Task Force on Food Safety and Director of Food Safety and Quality Unit of the Bahamas, Ms. Lisa James, Agricultural Economist of the Caribbean Agricultural Research and Development Institute, Dr. Carla Georges, Director of the School of Veterinary Medicine of the University of the West Indies, Dr. Satish Badesi, Dean of the Faculty of Food and Agriculture of the St. George's University, members of CARFA's Department Management Team, CARFA staff, members of the media, distinguished guests, colleagues, ladies and gentlemen, good morning. Sorry, my mic seems not to be working. Good morning. Excellent. On behalf of the Caribbean Public Health Agency, it is my pleasure to welcome all of you, our distinguished ministers, representatives of the government of Trinidad and Tobago, colleagues from CARFA member states, regional and international partners, and our technical experts to the second One Health Multidisciplinary Workshop to promote integrated surveillance for foodborne diseases and zoonosis. A very special welcome to those who have traveled from across the region to be here with us. We appreciate your commitment to strengthening health security and advancing One Health collaboration across the Caribbean. This year's workshop marks an important step forward. Last year, we developed the vision, strategy, and framework for integrated surveillance under the Pandemic Fund project. Today, we shift from strategy to full operationalization, from planning to implementation, from concepts to systems, and from coordination to action. The challenges of foodborne diseases and zoonosis do not respect borders, and neither must our surveillance systems or our partnerships. Without further ado, I would like to invite Dr. Lisa Indar, CARPHA's Executive Director, to bring welcome remarks and discuss the objectives of the workshop. Please welcome her as she comes to the podium.
Dr. the Honorable Lakram Bodo, Minister of Health, Trinidad and Tobago, who will be joining us soon. Senator the Honorable Ravi Ratram, Minister of Agriculture and Fisheries, Trinidad and Tobago. Dr. Lisa Musai, CARICOM Chief Veterinary Officer. Members of our EMT, all our partners who are listed here from PAHO, and SGU and CIRAD and UK HSA, UE, CARDI, OECS, CARVET, FAO, AICA, UNEP, the WAR, and others, all that Dr. Sami just listed, our member states, our national epidemiologists, our chief veterinary officer, chief environmental health officers, our CARPHA staff, welcome. Maybe I'll say that again. Good morning and welcome.
Good morning.
It is my pleasure to welcome all of you to the second One Health Multidisciplinary Workshop to promote integrated surveillance for foodborne diseases and zoonoses. I'm really happy to welcome over 83 participants today from 11 CARPHA member states and 18 agencies, which personifies One Health by itself, the integration of human, environmental, and animal sector for improving integrated foodborne disease surveillance and zoonotic surveillance. Before I begin, I want to take a moment to acknowledge the ongoing impact of Hurricane Melissa, which struck the region recently. Many communities, particularly in Jamaica, are recovering from the severe flooding, disrupted water systems, and food safety risk. Today, we continue to stand in solidarity with Jamaica, with all those who all the affected families and frontline responders, and we recognize the immense public health strain that these events can place on our system. As water, food, and sanitation infrastructures are disrupted, the risk of food and waterborne diseases increases sharply. And you all may have seen the news where there is an ongoing lepto outbreak at this time in this country. And it really emphasizes the need that when there are disasters, food and waterborne and vector-borne risk increases. At the same time, avian influenza activity in parts of the Americas and recently poultry die-offs reported in neighboring regions, right in our region, remind us that the animal health events can quickly spill over to affect food safety, trade, and human health. So together, these ongoing events are clear reminders that our One Health coordination, that is, integration of human, animal, and environmental surveillance, must remain strong, agile, and ready long before threats reaches our shores. Last year, right here in Trinidad, we took an important step together. For the first time, we brought together experts from public health, veterinary, agriculture, environment, lab, and food safety, all under one roof and at the same table to strengthen how we work as one region to prevent, detect, and respond to foodborne and zoonotic diseases. From that first workshop, we achieved several key milestones, which now anchors our regional One Health efforts. Together, we develop regional One Health foodborne diseases and a zoonotic action plan. We updated national One Health action plans for our participating member states, and we created the agency collaboration matrix to strengthen coordination, regional and international partners. That meeting also laid the foundation for the regional One Health coordination platform on SharePoint, the establishment of quarterly calls with our member states to support ongoing national plan updates, the expansion of commitments to interagency communication, and the establishment of bi-monthly One Health coordination calls. These outputs now will guide how we continue to integrate surveillance across the different sectors, how we share information and collaborate more efficiently within our borders and across our borders. So I want to thank everyone here today, our CAFA member states who work so hard, and I'm sure, you probably get tired of us with all the monthly calls, but the key to One Health is coordination and communication with everyone. I want to thank our regional and international partners and our agencies for continuing this journey with us. I want to single out Mr. Hua Shu and the IDB and the Pandemic Fund for providing the important funding impetus to be able to carry out this vision of One Health and integration of human, animal, and environmental surveillance for better response to One Health diseases. Your investment, Mr. Horseshoe and the IDB, has allowed CAFA and our member states to build the systems, the structures, and the capabilities needed to make our region safer and more resilient. Thank you for believing in CAFA's vision. Since we last met, we have made measurable progress. We have finalized the action plan. We have supported our member states. We have updated their national action plan. We have now an established One Health multisectoral steering committee, which now meets regularly with more than a dozen regional and international partners. We launched the region's first One Health SharePoint platform, connecting agencies for real-time information sharing and technical exchange and collaboration. And we initiated quarterly National Action Plan progress calls with member states. We also send out a newsletter. So this really speaks about one of the hallmarks of One Health, which is coordination and communication. These are major steps forward, but we know the plans and systems are only as strong as our ability to implement, to use, and to maintain them. So this is why we have the second workshop. It's all about implementation and integration. We're now moving forward from talk to action. We have delivered the tools, and now we want to implement. So over the next 2 days, we will demonstrate CAFA's novel regional integrated warning surveillance system and the One Health module, which are two major steps that bring human, animal, and environmental surveillance in one platform and strengthen our ability to detect and respond to threats quickly. I'm sure all our agencies and our countries here will be excited to be able to be on a platform that is confidential, but also able to see clinical, human, which is clinical, environmental, and animal data. Over the next 2 days too, you will have the opportunity to participate on our rapid response simulations, CAFA's own Tingwa outbreak exercise to test how we coordinate across sectors, not if, but likely when the next public health-related threat happens. These are practical, real-world exercises that will help us build the kind of readiness and the courage to face emerging public health threats. One Health is not a slogan, it's a way of working. It means that Ministry of Health cannot act alone. The Ministry of Agriculture cannot act alone. And as you see here, we have Minister of Agriculture as well. Our labs, our environment and health teams, our universities, our partners must come together. This is core to CARFA's mandate to facilitate carrying on our mandate to connect the dots between surveillance, lab, agriculture, and environmental system so that no information, no warning sign, and no outbreak slips through the crack. Together we can do this. The farm-to-fork approach, the farm-to-table approach we have been advocating is exactly that, integrating every point along the chain so that we can detect and prevent diseases before our community and our economies. This week, in this convening workshop, our goals are then to operationalize the integrated One Health foodborne disease and zoonotic surveillance platform that will be demonstrated, to strengthen agency coordination through interactive working sessions and simulation exercises. I really have to give a shout out to all the agencies I hear because we have been working the last year and they come to the different meetings that we have. It really speaks, as a testimony that to coordinate. Finally, to countries in implementing their national action plan or to build and strengthen national and regional hands-on multi-sectoral readiness exercises, and 5, to reinforce the One Health network, ensuring continuous communication, training, and support. This workshop is more than a workshop. It is a call to action. Every discussion, every demonstration, and every idea shared here today must translate into something concrete, into systems that protect people, prevent illness, and preserve livelihoods. Let us then use these 2 days to collaborate openly, to learn from each other, and to challenge ourselves to think differently, to think collaboration, to think integration. Together, we can ensure that our region remains proactive, prepared, and protected. Together, we can make the Caribbean a global transcending model for our One Health collaboration. Thank you once again for being here, for your dedication, and for your continued partnership. I want to say a special thank you to Ms. Tamara Bernard, our foodborne disease coordinator, who have worked tirelessly with the Pandemic Fund team to put this workshop together. So thank you, Ms. Bernard, for your excellent work. I wish you all a productive and engaging and inspiring workshop. Thank you very much.
Thank you, Dr. Indar, for bringing the welcome remarks and for setting the objectives of the workshop. And to reiterate what Dr. Indar said, she said One Health surveillance must be strong, agile, and ready to respond to public health threats. So thank you once again for all who have gathered today to ensure that thank you. All right, I understand the Minister of Health has arrived, so we welcome him. Yes, I see him. So we welcome the Honorable Ministers, the Honorable Lakram Bodo and the Honorable Dr. Resha Sicharan. Welcome again, ministers. So next on the agenda, we would like to show a video highlighting some of the major achievements of the project to date. So over to the IT team with the video.
In just under 2 years, CARFA.
All right, excellent. So I think we can all agree that the project execution unit has done a lot in a short period of time. So kudos to the team. We look forward to much more excellent outputs under this project. Next on the agenda, I would like to invite Mr. Ian Horseshoe, Senior Health Specialist from the IDB, to bring remarks. Over to you, Mr. Horseshoe. Please welcome him.
Morning. Dr. the Honorable Lakram Budu, Minister of Health of Trinidad and Tobago. Dr. the Honorable Rashad Sitran, Minister in the Ministry of Health, Trinidad and Tobago. Senator the Honorable Ravi Rataram, Minister of Agriculture and Fisheries, Trinidad and Tobago. My good friend, Dr. Lisa Indar, Executive Director, CARFA. Dr. Mark Sami, Director of Corporate Services, CARFA. CARFA officials, government officials, workshop participants, ladies and gentlemen. Good morning. I am going to be super brief. Usually when I stand here, everybody thinks I have a checkbook in my back pocket, but I don't have one today. So it is indeed a pleasure to be here with all of you as we continue our shared mission to strengthen public health across the Caribbean. On behalf of the Inter-American Development Bank, I'm honored to support CARFA and our partners in advancing the One Health approach. At the IDB, we see the Pandemic Fund project is of critical importance to our work because it directly supports the IDB's core development pillars. By strengthening health systems and pandemic preparedness, the project advances social inclusion and equality, ensuring that vulnerable Caribbean have access to essential health services during crisis. It also fosters productivity and innovation by investing in modern surveillance technologies, laboratory capacity, and workforce development, which are critical for resilient economies. Furthermore, the project promotes regional integration by enhancing coordination among Caribbean nations, enabling collective action and knowledge sharing to address cross-border health threats. Through these efforts, the Pandemic Fund exemplifies the IDB's commitment to sustainable development and a healthier, more equitable future for the region. Over the past year, our region has faced significant challenges, but together with CARFA, we've made remarkable progress. Most recently, we witnessed the devastation caused by Hurricane Melissa in Jamaica. In response, CARFA and the Pandemic Fund project mobilized quickly to provide emergency health supplies, technical guidance, and rapid health needs assessment. This support helped Jamaica manage public health risk, restore essential services, and protect communities from further harm. CARFA and the Pandemic Fund project also supported countries impacted by Hurricane Beryl not too long ago, delivering emergency supplies, deploying shelter surveillance tools, and providing technical guidance for disease prevention and control. We have worked with CARFA for more than 15 years, but on this particular project, we are about 2 years old, and CARFA continues to perform at an exceedingly high rate. Even though you saw it on the video, allow me to briefly, and I stress briefly, share some of the major achievements since 2024 on this project. Under surveillance and early warning, the project launched an electronic regional integrated surveillance system, including syndromic and event-based surveillance and a climate early warning system. The project also deployed a mass gathering surveillance system, which was used for the T20 Cricket World Cup across 6 coast countries, enabling real-time monitoring and rapid response to health threats. In terms of laboratory capacity, we expanded laboratory testing and antimicrobial resistance surveillance, including whole genomic sequencing and biosafety training. Conducted a regional workshop certifying trainers in infectious substances transport, strengthening biosafety and safe specimen handling. While under workforce development, the project delivered advanced training for public health professionals through the Caribbean FELTEP Level 2 program and established rapid response teams to boost surge capacity and ensuring timely interventions among many of our member states. With respect to regional coordination, a number of high-level meetings were done, workshops and stakeholder consultations, fostering new partnerships and networks for early warning and response. In addition, the project operationalized the Carrie Flynn Lab network and developed regional development network. In terms of research and knowledge sharing, which is particularly important to the IDB, the project published research on innovative surveillance systems and the benefits of real-time electronic tools for public health. CARFA's impact story was in fact featured by the Pandemic Fund Secretariat, highlighting how these investments are strengthening pandemic defenses in the Caribbean. But looking at the wide group of participants in today's workshop, I am also reminded that we are here today to deepen our regional coordination and foster collaboration. These partnerships are endorsed by the IDB strategy through its One Caribbean regional strategy, which focuses on building capacity within the region, enhancing resource sharing, ensuring timely response to public health threats, and working collaboratively to share real-time data for foodborne diseases surveillance and zoonosis, which can only serve to enhance the Caribbean's ability to respond to potential outbreaks and ensure better health outcomes. In closing, I would like to thank the dedicated teams at CARFA and at the IDB and all our partners throughout the region. The hard work and commitment demonstrated to date are making a real difference. Looking ahead, our goal remains clear: to reduce the impact of pandemics and other health threats in the Caribbean. While many may think that it is a lofty and ambitious goal, I can say with full conviction that it's an achievable goal given CARFA's stellar track record to date. Before I close, it would be remiss of me if I did not acknowledge some key people whose dedication to this project has gotten us to this point today. Special thanks to Dr. Lisa Indar, Dr. Mark Sami, Dr. Brian Amal, Dr. Kisundan, and the rest of the CARFA team for their tireless efforts. And trust me, I know tireless efforts with the emails at 3 o'clock in the morning, but that's okay. I must also acknowledge the hard work of the IDB team, especially my colleagues on the ground here in Trinidad and Tobago, and Alex Lewis, as well as colleague in Washington, Dr. Romero, for working closely with CARFA in our support, delivering targeted results across the health sector. This project is indeed a meaningful opportunity for CARFA with the support of the IDB, and of all of us here to create a positive impact and drive our mission to reducing public health impact of pandemics in the Caribbean going forward. By strengthening surveillance, promoting integrated approaches, and fostering regional partnerships, we are laying the foundation for a healthier future. Let's keep up the momentum as we work together. We continue to improve lives, protect our communities, and build a stronger Caribbean. Thank you all for your dedication, for being here today, and have a great workshop. Thank you.
Right. Thank you, Mr. Horseshoe. And on behalf of CARFA as well, thank you to the IDB for your support in implementing this project. We could not have reached this far without the IDB team, so thank you once more. I would now like to invite Senator, the Honorable Ravi Ratiram, Minister of Agriculture and Fisheries of the Republic of Trinidad and Tobago, to bring remarks. Please welcome him.
Dr. the Honorable Lakram Bodo, Minister of Health of Trinidad and Tobago, Dr. the Honorable Rishad Sicharan, Minister in the Ministry of Health, Dr. Lisa Musai, CARICOM Chief Veterinary Officer, Dr. Lisa Indar, Executive Director, CARFA, Dr. Mark Sami, Director of Corporate Services, CARFA, Dr. Horace Cox, Director of Surveillance, Disease Prevention and Control, CARFA, Mr. Ian Huashu, Senior Health Specialist, Inter-American Development Bank, Chief Veterinary Officers, National Epidemiology, I got it correct? Yes. Epidemiologists and food safety focal points, Chief Environmental Health Officers, Laboratory Disease, Laboratory Directors from our CARFA member states, Dr. Frank Devine, Advisor, Disease Surveillance and Epidemiology of the Pan American Health Organization, Ms. Nicole Damini, Program and Portfolio Specialist of the Food Agriculture Organization of the United Nations, Dr. Lisa Harinanan, Agricultural Health and Food Safety Specialist of the Inter-American Institute for Cooperation on Agriculture, Ms. Rachel Hunt, Principal Scientist of the UK Health Security Agency, Dr. Eric Ether, Veterinary Epidemiologist at the French Agricultural Research Center of International Development and Secretary with the Caribbean Animal Health Network, CaribVet, Dr. Tiola Noel, Chair of the Veterinary Working Group of the Caribbean Animal Health Network, Dr. Patricia Johnson, Chairperson of the Caribbean Task Force on Food Safety and Director, Food Safety and Quality Unit of the Bahamas, Lisa James, Agricultural Economist of the Caribbean Agricultural Research and Development Institute, CADI, Dr. Carla Georges, Director, School of Veterinary Medicine of the University of the West Indies, Dr. Satish Bidesi, Dean, Faculty of Food and Agriculture of St. George's University, CARFA staff, members of the media, distinguished guests, colleagues, ladies and gentlemen. First, allow me to apologize if I mispronounce anything, because I always said health and medicine is like a foreign language. So I do ask for your forgiveness. A pleasant good morning to each and every one of you. It is a privilege to join you as we open this second One Health Multidisciplinary Workshop and to stand alongside the many experts and institutions represented here today. Your presence is a reminder of just how interconnected our work has become and how essential it is that we continue to move forward as one unit, as we continue to move forward together. The One Health approach reminds us that the health of our people cannot be separated from the health of our animals and the health of our environment. This is not simply a technical framework. It is a lived reality for every nation in the Caribbean. Whether we are dealing with a disease outbreak in livestock, contamination in our food supply, or changes in our marine ecosystem, the impacts are felt across multiple sectors by every single citizen. The challenges we faced are not abstract. They are real, immediate, and often costly. Foodborne diseases continue to affect large numbers of people across the region, many of whom may never be captured in surveillance data. Zoonotic diseases, which account for the majority of emerging pathogens, continue to pose risks not only to public health, but also to agriculture, animal welfare, trade systems, and our rural economies. Concerns about contaminations, antimicrobial resistance, and new invasive species place strains on farmers, fisherfolks, processors, and households. And all of these threats move rapidly across borders. This is why CARFA's ongoing leadership under the Pandemic Fund initiative is so important. It strengthens our collective capacity to prepare, detect, and respond and ensure that no member state is left behind. Last year's inaugural workshop laid out the strategic direction. It updated national action plans, strengthened coordination amongst agencies, and deepened the region's commitment to One Health. This year, the work becomes even more meaningful because we are moving from strategy to operationalization. Over these next 2 days, you will be engaging directly with CARFA's Regional Integrated Early Warning and Surveillance System and the One Health module. This new platform represents one of the most significant advancements in regional surveillance in recent years. It will allow member states and agencies to see the same indicators across the same dashboard, review the same alerts, and coordinate responses more quickly and more effectively than ever before. You will also be reviewing and updating your national template, selecting priority indicators, strengthening data sharing agreements, and participating in rapid response simulation exercises. These activities are not routine. They directly shape how our health, agriculture, environmental, and veterinary system will function in the face of the next foodborne outbreak or zoonotic threat. As Minister of Agriculture and Fisheries, I want to underscore how closely our ministry work aligns with the direction of this workshop. We have been focusing on strengthening surveillance in livestock and poultry, working to detect early and limit their spread. We continue to promote strong biosecurity practice amongst farmers and to adopt international best standards to safeguard animal and plant health. We are improving the systems that support food safety, from farm and fishing vessels to market, agro-processors, and retailers. We recognize that food safety is not just a health issue. It is a national development issue. If we want to improve food security, reduce imports, expand exports, grow our blue economy, and build trust in our local products, we must ensure that our systems are robust at every stage. That is why our Chief Veterinary Officer remains closely involved in these regional efforts. Their work to the safer food, health, and stronger, more resilient communities. I also want to highlight the growing importance of our marine with the One Health framework. The ocean livelihoods protect our drive tourism. Yet it is to pollution, changes in climate and biological threats. Issues borne illness and invasive species that marine health must be fully integrated in the surveillance and response system. It can't be as secondary or separate. The discussions taking place here today will help us build that integration. When we improve our capacity to detect and respond across sectors, we improve our readiness at the national and regional levels. We also build greater confidence among consumers, trading partners, investors, and international agencies. But beyond the systems, beyond the dashboard, and the technical exercises, let us remember why we are doing this work. We are doing it for the parent in the supermarket who needs to feel confident. We are doing it for the parents in the supermarket who needs to feel confident about the food they placed in their basket, for the poultry farmer who depends on good surveillance to avoid losing an entire flock, for the fisher folk who need clean water and safe seafoods, and for the child who deserves a healthy meal every single day. Your work over the next 2 days directly affects these lives. It strengthens our frontline defense against threats that affect every home, every business, every community, and every citizen. So I want to encourage you to participate actively, ask questions, share your experience, challenge each other, and build on the strong partnership that have brought us to this moment. This is a space where real solutions can be shaped, where challenges can be openly discussed, and where new ideas can take root. When we operate alone, our vulnerabilities multiply. But when we coordinate, when we integrate our efforts, and when we share data and expertise across sectors and across borders, we not only strengthen our individual countries, we strengthen the Caribbean as a whole. So on behalf of the Ministry of Agriculture and Fisheries, I extend our deepest appreciation to CAFA, the Inter-American Development Bank, and all our regional and international partners who continue to support this critical work. Your commitment helps us safeguard our people, protect our food systems, and build a more resilient future for our region. I look forward to the outcome of this second workshop and to continue cooperations and innovations that will follow. I wish you all a productive, engaging, and successful session, and I thank you all for your participation. Thank you.
Thank you, Honorable Minister. And to reiterate what the Minister said, the health of our people cannot be separated from the health of our animals and the environment. So thank you again, Minister. And we also appreciate your commitment to food security initiatives. And we noted your representation in June of this year at the CARICOM ministerial meeting, where you reaffirmed Trinidad and Tobago's commitment to regional food security. So thank you once again. So finally, and very importantly, I would like to invite our keynote speaker, who has been a great friend and supporter of CARFA since assuming office as the Minister of Health for Trinidad and Tobago. So it is therefore my great honor to invite Dr. the Honorable Lakram Bodo, Minister of Health of the Republic of Trinidad and Tobago, to deliver the keynote address. Over to you, Minister.
Thank you very much, Dr. Sami, Director of Corporate Services, CAFA. Good morning, ladies and gentlemen. Good morning to all. I would want to beg your indulgence to stand on the protocols already observed, but just to permit me to recognize a few people who are here with us today. Of course, the Senator, the Honorable Ravi Ratiram, Minister of Agriculture and Fisheries of Trinidad and Tobago, and to endorse his very important message. And of course, to recognize the important partnership between the Ministry of Agriculture and Fisheries and the Ministry of Health going forward. I also recognize, of course, the Minister in the Ministry of Health who is here with us today, Dr. the Honorable Richard, and Dr. Lisa Musai, Veterinary Officer, Dr. Lisa Ayandar, Executive Director, very hardworking, of CAFA, and of course, Dr. Horace Cox, Director of Surveillance, Disease Prevention and Control, CAFA, and of course, I already recognize Dr. Mark Sami, Mr. Ian Hoyasu, Senior Health Specialist, Inter-American Development Bank, IDP, great partners of the Ministry of Health and the Government of Trinidad and Tobago. The Chief Veterinary Officers, we have here National Epidemiologist, Ravi, I think I got that one right, and food safety focal points. We have Chief Environmental Health Officers, Laboratory Directors. We have PAHO represented here, FAO. We have the Inter-American Institute for Cooperation and Agriculture. We have the UK Health Security Agency represented, CARIVET, CTFS, Caribbean Task Force on Food Safety. I'm calling these out so I can myself become familiar with all of these agencies going forward. We have CADI, been around for a while. We have the University of the West Indies represented. We have St. George's University as well. Members of the media, distinguished ladies and gentlemen. So it's a pleasure and a privilege to be here. I believe I can read this without the spectacles this morning. So I'm told that here in this room, we have 12 countries represented, 18 agencies, and 83 participants. On behalf of the Ministry of Health and the Government of Trinidad and Tobago, I want to say a very special welcome to all of you, and I thank you again for being here. It is a privilege to join you this morning for the opening of this second One Health Multidisciplinary Workshop, which focuses on strengthening integrated surveillance for foodborne diseases and zoonoses across the Caribbean. I extend my gratitude to CAFA for the opportunity to address you at this timely and critically important forum. So I'm here because I was invited, but I'm here because I also have a very special interest. And I know you are at the point where you're looking forward to the coffee break, so you'll have to tolerate me for just a few moments longer. But I just want to share two things. In 1986, I had to make a very important choice in terms of my career going forward as a doctor in terms of this specialty. And I had spent 6 months in my internship as a rotation in public health. And I became very close and very attached to public health. And then I went back into the hospital and I met a very charming specialist obstetrician gynecologist, very hardworking lady, Dr. Rajani Ramkisoon, some of you may know. And she convinced me, Lisa, that I should do obstetrics and gynecology instead of public health, but public health has remained to my heart closely, very closely. And of course, as the universe would have it, I now have the chance again to participate in public health at a different level. And the second experience I want to share is that I myself am a victim of a foodborne illness. Many, many, many years ago, I visited the then popular destination of Margarita for what I thought would be a wonderful weekend with my wife and family, only to spend 3 days in a very fancy hotel, not being able to leave the room because I was a victim of a foodborne illness. Afterwards, when I did my surveillance and what do you call it? I think there's an epidemiological term for it, Lisa. I realized that I was a victim of oysters, which I had 2 or 3 days prior to my trip. And of course, it was hot, but I believe it was also the heat that caused the foodborne illness. And therefore, that is one of the lessons I learned early, I still have oysters, but now I ensure that it's served at the right temperature and stored in the right conditions. So I think that is perhaps the gist of what we are about here today in terms of foodborne illness. But of course, there's a lot more to this workshop than that. And this workshop represents the continued commitment of CARPHA, CARICOM member states, the Inter-American Development Bank, and regional ministries of health to reduce the public health impact of pandemics. The COVID-19 pandemic taught us many lessons, but perhaps the most important is that regional coordination is not optional. It is essential to our survival and resilience as Caribbean nations. Here in Trinidad and Tobago, surveillance has become a cornerstone of our health sector reform agenda. The national surveillance reports have highlighted several areas where the One Health approach must play a greater role in strengthening our readiness and response systems. For example, foodborne diseases continue to pose a substantial public health challenge, both locally and across the region. If I may refer to an article in June 2023, a CARPHA article, Food Safety is Everybody's Business. It reveals that approximately 142,000 people contract a foodborne illness each year. That comes down to 1 in 49 persons. But interestingly, during large events like cricket and football and carnival, this risk increases to about 1 in 11 persons. So it is a statistic worthy of concern. This regional health burden highlights the urgency of integrating surveillance, inspection systems, and robust food safety programs. At the same time, zoonotic diseases, which are those transmissible between animals and humans, remain an area of growing concern given our ecological characteristics, agricultural practices, and import trade patterns. And again, I want to commend my colleague, the Minister of Agriculture and Fisheries, for his very important work so far in a short time as Minister of Agriculture in focusing on these very, very important areas. CARPHA continues to emphasize the importance of a One Health framework, and Dr. Indar, the government is also looking at a One Health approach, and I will share that in a moment in terms of how we govern in the health sector going forward. So the One Health approach, of course, that CARPHA emphasizes, unites veterinary, environmental, and human health sectors to prevent the spread of infections originating from animal reservoirs or contaminated animal products. The PAHO WHO country office further supports strengthening our monitoring of neglected infectious diseases and improving cross-sectoral coordination as part of broader health security efforts. Additionally, the Caribbean continues to remain vulnerable to vector-borne diseases such as dengue, which resulted in more than 2,000 confirmed cases and 19 deaths in Trinidad and Tobago in 2024, highlighting the importance of timely detection and rapid response. Luckily, fortunately, this year so far for 2025, the numbers have been much less, and the deaths have remained in single digits. So, but of course, Zika and dengue and other insect vector diseases are very important, but still remain threats. So these threats reinforce the need for strong laboratory and surveillance capacity. In 2024, the Trinidad Public Health Laboratory, supported by CARPHA's regional laboratory, tested more than 11,000 samples for arboviruses such as dengue, chikungunya, and Zika. So this level of collaboration demonstrates the critical role of shared laboratory systems in early detection and regional response. And again, I want to take this opportunity to thank CARPHA as a very strong partner, not only to the government of Trinidad and Tobago, but of course to the region, and to endorse the very important work that this regional body continues to do. I also want to congratulate CARPHA and its executive on the recently commissioned insectary. I got that right. Recently commissioned insectary at the headquarters in Federation Park, which will lend a lot of capacity and capability, not only to Trinidad and Tobago, but of course across the region. So collectively, the patterns we spoke about point to one undeniable truth: human health, animal health, and the environment are deeply interconnected, and therefore we cannot address outbreaks or emergent threats in silos. And I believe this is what this workshop is all about, to come together, to recognize this important relationship. CARFA's leadership in operationalizing the One Health framework places the Caribbean at the forefront of integrated surveillance systems. This workshop further advances that vision by demonstrating effective surveillance models for foodborne diseases, improving early warning systems, as we saw in the video played earlier, through timely reporting and data sharing, training key focal points in One Health-based surveillance for the FPDs and zoonoses, enhancing cooperation across environmental, veterinary, and human health sectors, and strengthening laboratory networks and national capacities. I mentioned earlier that the approach of the Ministry of Health, and there are many initiatives at the Ministry of Health, but what I would want to state is that at the very highest level, it is the intention to look at what we would call a health in all policies going forward to be instituted. And therefore, I want to invite my colleague, the Minister of Agriculture and Fisheries, to be one of the first in terms of joining that partnership. So the intention, of course, would be for several ministries to be involved, and eventually all ministries to be involved in terms of, recognizing health as part of the program going forward. The recently awarded Pandemic Fund grant for the TT1 Lab Plus project represents another major milestone as it seeks to build a unified One Health laboratory system that will significantly enhance diagnostic capacity for surveillance and outbreak investigations. Of course, again, I want to recognize and thank the IDB for their very important support project. So the reality is that health threats do not respect borders. Foodborne diseases, zoonoses, and pandemics can move swiftly across our islands. This is why regional approach, which brings together epidemiologists, laboratory scientists, veterinarians, environmental health officers, and policymakers, is indispensable. The Caribbean is strongest when we operate as a collective. No single country can maintain every surveillance system, detect every emerging pathogen, or manage every outbreak alone. Therefore, our greatest asset is our regional solidarity. On behalf of the government of Trinidad and Tobago, I want to express sincere appreciation to CARFA, the Inter-American Development Bank, and all regional and international partners who continue to support the strengthening of public health systems across the Caribbean. Let us continue to work together across ministries, across borders, and across disciplines to build a healthier, safer, and more resilient Caribbean. I wish you a very productive workshop, and as my colleague mentioned, I too, as Minister of Health, look forward to the findings of your deliberations in this very, very important workshop. So thank you so much. Thank you.
Thank you, Honorable Minister. Thank you for your remarks, and we appreciate your dynamic leadership, Minister, and your visible commitment to strengthening regional security through your continued support for CARFA. We truly appreciate it, and we look forward to a strong and fruitful relationship with you and the Ministry. All right, so ladies and gentlemen, we have come to the end of our ceremony. Thank you once again for being here. It is now my pleasure to officially open the workshop and invite you to participate fully as we continue building the integrated One Health surveillance system the Caribbean deserves. Next, we would like to do photo sessions. So we would like the head table to remain for photos in the building We're going to ask all other participants to please gather outside. You'll be directed by one of our colleagues to where you will assemble while the head table takes a few photos. Thank you very much. So, colleagues, please direct the participants to the photo area outside, and we'll ask Minister Reshad Sicharan to remain as well for the head table photo. Thank you.